Now, good morning, everyone, and thank you for joining us this morning. We're really pleased to have Jennifer Burkhardt from OMC join us once again to share with us what is happening with the largest employer in our county, and also to talk about the vaccination efforts that OMC and the community as a whole have been undertaking. So with that, if you have any questions towards the end, later on, we'll go ahead and ask you to put your questions in the chat, and you can go, and Jennifer will be answering those questions. And so for now, if you'd put your computer on mute to make sure background noise doesn't interfere, we'd really appreciate it. So Jennifer, thanks so much for joining us, and take it away.
Thank you, Colleen. It's really a pleasure to be here this morning, and good morning to everyone. It's nice to see so many familiar faces. For those of you that I haven't had the pleasure of meeting, my name is Jennifer Burkhardt, and I work at Olympic Medical Center. I'm the Chief Human Resources Officer and General Counsel. I've been here for 8 years. I grew up in Port Angeles, so a Port Angeles native, like some others that I see on the call. I really care about this community, and I was really glad to be able to move back here about 12 years ago in order to raise my family here. So it's really great to see all of you. Providing a little bit of an update on COVID-19 to start off. I think most of us saw the news headlines this week that unfortunately COVID has now taken the lives of over 500,000 people. So that was a grim statistic to see. And in fact, the number of lives that it has taken has doubled in the past 3 months. In Clallam County, we're not seeing those kinds of statistics. In fact, we have avoided, for the most part, those kind of surging numbers. To date, we've had 992 confirmed cases in Clallam County, but we've been able to reduce our current rate of cases per 100,000 down to 50. Which has put us in the orange or moderate risk zone in Clallam County, which is really excellent progress. During an earlier call with this group in November, and then following up, I think it was in January, the statistics were much higher for our rate of cases per 100,000. In fact, at one point they were 4 times as high. So that's really a good trajectory for us to be seeing that our rate of positivity is also down at only 2.8%. We're really happy to see that our community has worked together in order to move us to phase 2. That's good, positive progress, but we still have a lot of work to do. So because it's so important to our economic recovery, I did want to touch on the vaccination effort today that Olympic Medical Center has really been working hard to support in our community. We have been receiving a fairly consistent supply of doses of vaccine, which is really positive. We started at the end of December, receiving about 1,000 doses per week. And I shared with Colleen last week that we did miss our shipment last week, and we're not sure if that was due to the inclement weather or supply issues, but that was the first week that we had missed our supply. We're back to receiving our supply this week, I'm happy to report. So that is excellent news for Clallam County. We currently have 3,570 doses in our ultra low freezer for Pfizer vaccine. And then we're expecting another shipment today of approximately 1,000 doses. We've been donating all of our excess vaccine to Clallam County for the community. We first vaccinated healthcare workers, including all of the Olympic Medical Center employees who opted for the vaccine, and some other healthcare workers in Clallam County, and thereafter have provided the vaccine to the county for distribution. With regard to the vaccine effort, we're also sending staff out to Jamestown twice a week. We hired additional nurses in order to support the effort in SQUIM as well. So with that, we are also hiring additional staff for the Port Angeles clinics. And this weekend, we will be providing about 1,000 doses per day at Port Angeles at the high school, with the hope of further increasing our percentage in Clallam County. We're doing really well. I checked the state dashboard for the Department of Health this morning, and it looks as if we have about 20,000 individuals vaccinated in Clallam County, which is about 26% of our population. We also have 10,000 who have received both doses. So that's also excellent as we continue to fully vaccinate. the county. Right now, we're working through Tier 1A and Tier 1B. So I think most of you know that's the healthcare workers, first responders, long-term care facilities, the residents and the staff, and then those who are 65 and older. We're hoping to have in Clallam County 90% of those two groups fully vaccinated by the end of this month. And beginning in March, the hope is that we will start vaccinating those in Tier 1B2. And those are individuals who are age 50 and older and in certain high-risk professions, including teachers, childcare, public transit, jail employees, grocery stores, law enforcement, and others. So we're really excited to move into that next phase of the vaccination with the hope that we will further reopen our county, and that will continue to help us from the economic standpoint. I think everyone's aware that it's been really devastating for all of us with the businesses closed for some period of time, with even those businesses such as OMC that were open. We've had a tremendous draw on our finances and on our workforce and staffing. So turning to our finances, I thought I would give you a brief report on the impact of COVID-19, because when we closed the books for 2020, the impact was really staggering. We closed out the financial books and looked at the expenses related to COVID-19 specifically. And as you can expect, the expenses related to personal protective equipment, or PPE, were very high. Year over year, we determined that we spent approximately $1.7 million more on PPE than we had in the previous year. And that was despite the fact that we were on allocation from most of our suppliers, meaning that they were giving us only a percentage of what they had previously given us in response to our orders. So with most of our PPE supplies, we were getting somewhere in the neighborhood of 30% allocation. But despite that, we were able to dig in early on and begin amassing supplies on PPE. And so we've been able to maintain a consistent supply throughout the last 12 months. And at most junctures, we've had at least 90 days of supply on hand, so that our staff felt very secure that we had sufficient PPE to be able to care for those in our healthcare facilities. On non-PPE and non-capital supplies, and these are items such as thermometers, syringes, and other supplies of that nature, the expenditures were nearly $1 million, coming in at $853,000 for the year. And then in additional capital, we purchased ventilators. You might have heard early on in the pandemic, there was a shortage regarding ventilators in the nation. So we did stock up on those, as well as increased our bed capacity in the event that we would potentially have a surge. So those capital expenditures totaled approximately $380,000. And then one of the big efforts that we made for our community was stepping up to provide the COVID testing. We had drive-through testing available, and we continue to do that. We also provide pre-procedural testing for those who are going into the hospital for surgeries and so forth. And that's been a big expense. We provided it far beyond just the hospital. It was available and continues to be available to the community. So the investment in the COVID testing with the lab supplies and the send out costs and so forth has been around $2.6 million. But by far the biggest expenditure for us has been staffing, and that's the additional salaries for those. We had the emergency department coverage was stepped up quite a bit so that we would be prepared for a surge. We had those who were doing the COVID testing, as well as the vaccination distribution, and other coverage related to the surge, and that was about $4.1 million. So our lost revenue for the year was in the neighborhood of $4.9 million, and the operating income loss of about $3 million. We are still in the process of looking at what the offset will be for provider relief funds. So some of that we do expect to be offset. But one of the big themes that we have tried to urge the community throughout the pandemic is to continue to seek care, because we have seen those who are opting not to seek health care during the pandemic. That's resulted in our emergency department seeing about an 18% drop year over year in patients coming through the ED. And our surgeries were down about 20% for the year in 2020. Some of that was related to the governor's order. There was a time when we were unable to do any non-urgent surgeries at all. And we're just now fully up to our 4 lines of surgery at OMC, and really trying to encourage those who have surgery scheduled to get in for that necessary care. So a continuing theme for us is really trying to get out the word that clinics are open, that our walk-in clinic has been available, that our ED continues to see staff, and that our surgeries are continuing. So our finances sound pretty bleak when I go through all of those numbers, and I understand that. Again, we have provider relief funds that we're hoping are going to offset most losses, but there's no question that for most businesses in Clallam County, it's been a huge detrimental impact, and we've felt that. We have continued to be very financially stable despite everything that I just reviewed. We have always been managed very conservatively, and that has helped us to maintain a really solid base throughout the pandemic. One of the things that really helps is we also have tremendous community support, including legislative support from our local state legislators, as well as our federal congressmen and senators. And we work really hard on legislative advocacy in order to maintain a reimbursement stream. We have 83% of our patients that we see at Olympic Medical Center are supported by the government, whether a program such as Medicare, Medicaid, TRICARE, or other government programs. So that means that government reimbursement is extremely important to OMC. Currently, we're working at the federal level on advocating with our Congressman Kilmer and Senators Murray and Cantwell on the $1.9 trillion COVID relief package that is being proposed by the Biden administration. It's going through a reconciliation process right now, and it's pretty unclear what provisions will be included in the final outcome of that. We are continuing to work on some aspects of that, specifically related to provider relief funding, determining what might be available for frontline workers in liability protections, and whether or not sequester relief will continue, because that's something that's been in the background also. So we're tracking that and just working with our legislators in terms of trying to see what comes out of that process. The other big topic in DC that we're tracking right now at the federal level is the naming of certain leaders in administrative posts. So the Biden administration is naming cabinet members and then agency heads. And for OMC, I think most of you probably saw the news stories in the past few years about site neutral and the cuts that we experienced. This primarily impacted our SQUIM campus, but it's a 60% cut to any clinics that are located more than 250 yards from the acute care hospital. So that's any of our clinics, whether in Port Angeles, 8th and Vine, and so forth. That results in a $47 million cut over the next 10 years for OMC, so quite significant. What's important about the appointments at the federal level is that the Health and Human Services Department is over the agency Centers for Medicare and Medicaid Services, which is the agency that made the ruling that resulted in the site neutral cuts. So we have seen 2 nominations come through. They're not confirmed yet. One for the Health and Human Services Department is Xavier Becerra, and for CMS, the nominee is Chiquita Brooks-LaSure. And in talking with Congressman Kilmer's office, once we have nominations that are actually confirmed in those roles, he will be working with us to set up a meeting with CMS so that we can talk about potentially getting that rule reversed, which would have a huge impact for OMC and for our community. I mean, we really have had to put on hold some expansion of services in the past couple of years because of those cuts. And in particular, there are a lot of services in SQUIM that we would like to expand, but haven't been able to necessarily move into yet. And so some of those plans continue to be on hold. So we are optimistic that hopefully working with those new appointments, we'll be able to make some progress. And Representative Kilmer has been extremely helpful in moving that forward. And at the state level, we've been working with our local legislative delegation, Representative Chapman, Representative Farringer, and Senator Vandeweghe, on requesting a continuation of Medicaid funding that has been very helpful in keeping us steady and stable throughout the pandemic. It's one of the reasons that OMC has remained in good stead. So we're grateful that they have been really champions of rural healthcare. It's a bipartisan issue. We're finding both at the state and federal level, there are those on both sides of the aisle that support rural healthcare. And that's positive to see. Finding the dollars is always difficult and challenging. But I will mention that, Colleen, you've been doing a great job with the North Olympic Legislative Alliance and working with the lobbyist liaison, Josh Weiss, has been great. And I think our community working together is really helping in the legislative arena, that when there are common voices on some of these issues, we're able to make progress. So that's definitely been something that we're pleased to see. Our legislators definitely listen. I mentioned on an earlier call a bill, KETAM bill, which is House Bill 1076, and how that could potentially impact businesses in our community in a negative way. And I hear from the legislators that they did receive calls and letters from members of the community, the business community, commenting on that. It would expand litigation. It could potentially be abusive. There's only one other state in the country that has a law that would allow individuals to sue on behalf of the Department of Labor and Industries for workplace violations, and that's California. And it's been tremendously detrimental in California. So it's good to see that our legislators are listening and they're responsive. And I think democracy works in terms of speaking up and being able to have a voice. So that's good. I'll mention we have a long list of bills that we're in favor of, and those that are not necessarily as good for OMC and impact, but it would take way too long to go through all of them. So one other that I'll mention that is important to local businesses, I think, is House Bill 1097, which I think would have an unfavorable impact for businesses in that it creates a presumption that any worker who contracts COVID-19 was exposed in the workplace, and it was a workplace transmission, and therefore the employer is responsible from the standpoint of workers' compensation. And at least at OMC, and I think this is common to most of the businesses in Clallam County, that we have not seen workplace transmissions. We have a low prevalence rate, but that prevalence rate is due primarily to community transmission. So we're concerned about that particular bill creating a presumption that would be difficult to overcome for employers. Lastly, I'll just mention that our workforce continues to hold steady at approximately 1,600 employees. One of our biggest, most growing areas is the outpatient clinic setting. So despite those site neutral cuts that I talked about earlier, we do continue to add providers. In fact, over the last 12 months, we added 31 physicians and advanced practice clinicians, which was really a bright spot for us. Our provider recruiter has shared that it's a good story to be able to tell. Even in healthcare, there have been a lot of systems that have done furloughs, that have had to engage in layoffs, that have reduced physician and APC salaries. And as I mentioned, we've been consistent, we've been stable, and so we've been able to recruit, which is really somewhat unique in this environment. We're really happy to report that we've been able to fill some hard to fill positions in cardiology, a psychiatrist, a wound advanced practice clinician, and some areas in primary care that we were also needing to buttress. So those were really some positive aspects of the recruitment. And beyond that, we have a number of openings, in fact, 155 openings with 22 registered nurse openings, a number of medical assistant and surgery techs and respiratory therapist openings. So we're just continuing to really work hard to recruit for the highly skilled and technical workforce. I think that one of the themes, I'll end here and take questions, and I'll try to look to the chat. I'm sorry, it's hard to look back and forth between those, but I'll try to take any questions that are pending. Working together as a community has been really successful. As I mentioned, on the legislative advocacy front, the vaccination effort has been a huge community effort. Our partners at Jamestown, at North Olympic Healthcare Network, Clallam County Public Health, we can't say enough about the Emergency Operations Center. The EOC has had numerous volunteers, and when you see one of these vaccination clinics working so smoothly and so efficiently, it's pretty evident that our community works well together, that we're collaborative, and that that's resulting in more success than other counties are seeing in Washington and even across the nation. So that would be the last comment I would make, is that even with the challenge of the variants that we're seeing and some of the hurdles that we'll continue to face in trying to overcome this pandemic, I think we're well positioned in our community because of the way we've been working together. And a huge thank you to everyone for that. And I'll go ahead and take questions.
Great. Thanks, Jennifer. I posted two that are similar to one another. The first is that, have you heard about any information on the next phases for the governor's roadmap to recovery, and what would the metrics be for those phases?
I do not have any more specific information than what I've read in the newspaper. And I know that, as John noted, we have had concerns about the metrics that have been used both for reopening Clallam County and being aggregated with other counties, not just Clallam County statistics. That's definitely been something that we're concerned about, and the regionalization of healthcare for similar reasons, that we're very focused on our local statistics and serving our local community, and we're not necessarily in favor of having the statistics from, say, a larger county like Kitsap or a smaller county like Mason being included with Clallam County statistics. But I'm sorry, I don't have any more specific information on that.
Okay, thank you. Yeah, and I see that John Nutter has as well searched for the individual county information rather than just the aggregated information that the Department of Health is now showing. And it says that the source of the information is the Washington Disease Reporting System. But I've searched through that and can't find any information about where they're displaying what the individual counties' metrics were before they're rolled up into a region. So next question was, from Laurel. Laurel, do you want to ask your question?
Sure. I've been following the news about the governor's proposal to regionalize our Board of Health, and I find that just bizarre. It's, as John said in the chat, it's a solution to a problem we don't have, and it kind of goes along with what you were saying earlier about individual counties. So John says that a letter is going out from the OMC board. I would like to know if this proposal actually happened, how would that affect the operations of OMC and care given to people here in the community?
Sorry, having momentary technical difficulties. I think that's a great question. I don't know that we are able to predict all the impacts, but I can tell you what our concerns are about the impact. OMC has really tried hard to remain locally owned and operated because we have the ability then to listen to the community, which is essentially, the taxpayers are big contributors. I would say they're the owners, they're the bosses of OMC ultimately. And that really helps us to be responsive to the local community. We're governed by a publicly elected board of commissioners, 7 of them. Mr. Nutter is on the phone with us. And those publicly elected officials listen to the constituents that they have in Clallam County and are able to report back in a very timely manner, in a very personal manner, at bi-weekly board meetings, what the community wants and needs. And so from our perspective, it's a really good method of governance, and we have tried to remain locally owned and operated so that we can maintain that independence and not necessarily be controlled by owners that might be in another state or somewhere elsewhere than in Clallam County. So the concern that we have from the regionalization perspective is that decisions would be made,
listening to
from a broader perspective. If, for example, we had at the outset of the pandemic had to go through public health that was located in Kitsap County instead of Clallam County in order to obtain PPE, which was in short supply right at the beginning of COVID, that would have been a concern. And I don't know that we would be given the level of priority that we were at the local level. So the idea that decisions would be made without concern regarding the impact to our local county and our demographics, I think is the one that really drives our desire to discuss more about the regionalization and really our concerns about the impact of it.
Okay, thank you. Kai, you have a question?
Yes, thank you. First, I want to compliment all of our medical professionals on the exceptional job they've done over the last year, and also now with this tremendous job of administering the vaccines. What I was wondering is whether the hospital might be able to use its sheer size and its IT expertise, which of course far dwarfs what the public health department at the county level has, to help with streamlining the sign-up process for receiving vaccines. As I understand it, there are state vaccines which in this county don't follow exactly the state guidelines, in the sense that those over 50 who are caregivers for older people are currently not eligible, but they are eligible for the federal vaccines that are given at the Safeway stores, which have a different website to sign up than the vaccines given at the high school. For both of them, it's kind of hard for people to figure out. It's kind of a race for the fastest internet connection, the first people to sign up. When you go to the website, you sometimes don't know when the next time is to sign up. So I've heard from people who are willing to receive the vaccine who would seem to be an eligible category and who just have a hard time to find out how to sign up. And if you think for the future, there's a possibility to set up some kind of a unified system, maybe even with a waiting list where you get a date 8 weeks from now, but you don't have to keep checking every 3 days on multiple websites to see where you might fit in.
I definitely think that's an excellent suggestion, and I'll share that we've been providing resources to the county on a very consistent level. We talk with them, if not daily, several times a week, and so we're definitely trying to offer our resources. And they have been the primary drivers of that sign up, the website, and how that's been working. But we've offered some IT support and have we've been taken up on that to a certain extent with the clinics that we have been doing at the high school. And with that suggestion, I will reach out and ask whether or not there is further support that we can provide in terms of the sign up process. I think you have a good suggestion in terms of being able to sign up further out in the future, because right now the slots fill up extremely fast.
Mm-hmm.
Thank you.
Great point, Kai. I know that the EDC has been trying to collate information about essential businesses for the county so that the county can, Dr. Berry's office can communicate via email and through phone calls with the different essential businesses to ensure that they are coordinating sign up times for their employees if they are interested in doing that. So we've been offering that information to them, but as you probably know, our state doesn't allow that information to be shared. So it's because it's considered proprietary, and so not even the county has a list of businesses or the public health department. So we've been doing the mundane and difficult work. Thank you to Amy Conkle, this has been her life for the last few months, trying to get good information and email addresses for all the different businesses, the 6,742 businesses that DOR says we have across Clallam County. So next, Catherine, you had a question from Clallam Mosaic?
Yes, and this is a good follow-up with the previous question because it also has to do with access to. So at the state level, there's recognition of the high need to vaccinate individuals with developmental disabilities, especially those with Down syndrome, who has also been recognized by the CDC as an extreme comorbidity. However, local families and individuals are frustrated because they are not being able to get the vaccine because it's usually cut off as soon as they give an age. And I was just wondering if there's a way to facilitate an additional pathway to vaccinate for these families and individuals who have basically not left their house since last March because of the extreme fragility of these individuals. The other issue is, the state phase finder, which I know does not make appointments, but we're telling people to go and use that. And based on these comorbidity, I can't even speak this morning, excuse me. The phase finder will say, yes, you can go get your vaccination, but when they try to make it locally, they are told no. So there's some frustration.
Yeah, I would, first of all, thank you for that, that question. I think it's a really important one. And there are two areas where we're working on that, but I do hear that I think we need to redouble our efforts. One is on a Washington State Hospital Association level. We've been talking as recently as yesterday, and I have another call at 9 o'clock this morning about distribution of vaccine from an equity standpoint and some of the concerns that are arising, both from communities. There are communities of color, there are communities where economic disparities are evident, and then other groups of individuals that are not finding access to the vaccination process as readily as others. And that's a big concern. So we're working with the governor's office to try to address that so that there will be less disparities for various groups. And I think, as you just mentioned, those who are in need in our county are one of the most important groups. And then you mentioned housebound individuals as well. And I think that's a really important category. One of the things that we have done is step up in terms of volunteering for at OMC to work with County Public Health to take the vaccine out to those who are homebound. We started with our home health population, and we hired additional nurses and took some of the vaccine doses that were allocated to us. And we have been vaccinating those individuals who are homebound. And we've gone through most of our initial list. And so one of the things that I will ask is, with regard to that program, if there are ways to get some of those that you just mentioned who don't have access to the vaccine right now on that list, which we're voluntarily visiting in home. So I think that would be an important resource to offer.
Oh, that would be incredible to be able to. I know a couple of families that, are not even stepping outside the door. Whereas if they could get the vaccine delivered to them, would be incredible.
So I can definitely at least raise that question. I think it's a really important one, and I appreciate you bringing it forward.
Thank you.
And Jennifer, didn't we hear from Ron Allen that they aren't necessarily turning people away that don't fall into the category specifically if they live in the SQUIM area?
Yeah, what's interesting, I'm glad you mentioned that, Colleen, is that because the tribes operate outside the purview of some of the same regulations, including the governor proclamations, they have been able to be a little bit more lenient in some respects. And that's one of the areas where my understanding is they have not turned away individuals who are there asking to receive the vaccine.
So I see that Commissioner Johnson is on with us. Commissioner Johnson, is there anything you would like to share?
Thank you, Colleen. First of all, thank you, Jennifer. I appreciate always catching up. I don't really have anything to add. I, as you know, have been very vocal about the whole regionalization of and thought process the state legislature is going through right now. And my hope is still that our local representatives and senator listen to us and will at least take our input. Certainly, I thank the hospital for also signing on to the letter to, I think it's, we're always better being cohesive across the North Peninsula than individual inputs to them. But and again, I thank everyone for stepping up on that thing. I think, as everyone said, our healthcare system here has certainly had some fits and starts, but has worked well because I think all the people try to work well together, and I'm so appreciative of that. And I just hate to see something to decimate that one way and or another. But those are my only comments. Thank you.
Thank you, Commissioner Johnson. We also have Casey Duff on with us. He is from Senator Cantwell's office. Casey, are there any updates that you could share from the senator's work?
Hi, everybody. Hi, Colleen. Thank you for having me on and giving me the opportunity. Not a ton to update on right now. I mean, we just got back into session after a short recess following the conclusion of the impeachment trial. So we're looking to buckle down on a lot of different things right now. The Senator just had a hearing on environment or energy and natural resources with the nominee for Secretary of the Interior, Deb Haaland. She was very supportive of her, and we're excited to see that nomination move forward for Department of the Interior. Other nominees coming down the pipeline in the future, please keep your eyes out for that. Also, since the last time I was here, we have officially taken over the gavel on the Senate Commerce Committee. So not a ton to do for this current COVID package. It focuses a lot on health outcomes, but with the rumored infrastructure package, the Commerce Committee oversees transportation, technology, things like that. So there will be a lot of work to be done on that package in the Commerce Committee, and I'll try and do a really good job of sending out press releases and things like that to Colleen, and she can circulate it among the membership to make sure everybody's kept up to date and keep coming on here as that happens. Some priorities for the Senator going forward are going to be things like transportation, freight infrastructure, rural broadband is going to be a massive push. I've tried to do a bunch of outreach already, get in touch with folks on the peninsula to figure out, what exactly the needs are around rural broadband and how we can continue a lot of the important work that's already being done and supplement that to build out broadband infrastructure out here. So those are just a quick snapshot of things. I'll see if I can't come back next week with a little bit more prepared and some better updates. And I'm sorry to not be completely on top of the ball right now, but we are really excited about the prospects of getting a lot of done in this administration, and I'll try and make sure that everybody here's enough of me until you're in, but not enough that you're sick of me and all the updates that I'll have to give.
Thank you. One item that we're really watching closely, of course, is any funding for Blackball. We saw that in the Miss Sarah funding that the program that was included in the NDAA package, that passed. The program was part of it, but there was no funding for it. And it doesn't appear that there's any funding in this $1.9 trillion funding package that would be specifically for Blackball, or no funding for the Mitsera program. I know there's a little bit of funding relatively for the CERTS program, but what I understand is that would only be likely a couple $100,000 for Blackball, which, considering that they lost $4 million last year, that isn't going to help them much at all. And things are becoming more and more, I don't want to say desperate, but definitely problematic for them. And, they will be able to operate after other businesses are able to open, because Canada just is not opening that border anytime soon. So is there any update in that space? I know your team is working on it hard along with Congressman Kilmer's and Senator Murray's, but of course there's 538 legislators that have to be convinced. And so has there been any progress in that realm?
Not that I'm aware of, but that doesn't mean that there hasn't been. And our DC policy team has been hard at work, and during the recess, we get a little bit separated from them for a lot of things. So this week I've been trying to check in on a lot of these projects, and that's when I'll give our transportation policy squad a call here later today and see if I can't get some answers for maybe next time I hop on, maybe next week.
That would be great.
Yeah.
Thank you so
absolutely.
much, Casey.
And then
Really
just one more
appreciate
plug I'd like to throw out there. We are kind of reaching a pretty significant grant season. A lot of things are opening up, applications. Our grants coordinator, Madison Brown, they're doing a really good job sending opportunities out to outreach directors to try and circulate. I just want to say, if there's anything that any folks on this call are looking for federal grants on, please let us know. It's always, we'd like to keep tabs on what's being applied for. And then also we're happy to write letters of support as needed for those types of federal grants. So please keep us up to date. I'll throw my email in the chat, and feel free to reach out, shoot me an email whenever.
Great. Thank you so much, Casey. If other people have questions, please feel free to ask them, but I thought I'd take this opportunity to share that the Department of Commerce is working on the Working Washington 4 grant program, that they have a proposal out and they are vetting it with the different EDCs across the county or across the state. And it looks like there will be about 3,100 businesses that would be receiving those funds, and it will be around 25,000, but because of the way the legislature wrote the bill, if a business received any Working Washington funds in the past, it has to be subtracted from that amount. And they are really trying to target these funds to businesses that have been the most impacted. So it won't be for nonprofits. It won't be for construction, real estate, et cetera. So they've got a long list of businesses that would not be eligible. They haven't formally announced this, but that's the expectation going forward. They expect it to be open, the window to open up mid-March. So of course, we'll have a lot of information coming out on that, and we'll be reaching out to those businesses, actively reaching out, not just emails through Constant Contact, but through phone calls and individual emails to those businesses that we think might be able to apply, and especially those that didn't receive any funding in the past. So it's a lot of outreach on the EDC's behalf is what much of our focus is nowadays. So Casey Duff did put in the chat his contact information if anybody has any questions or concerns they want to ask of him. So does anybody else want to just come off of mute and ask Jennifer or anyone else a question today? Brown, do you have something? You're always a curious newspaper and radio guy.
Thank you, but not today, Colleen.
Okay. Okay. All right. Well, with that, we do have Jim Vleming who's with us, and we had talked previously about Jim staying on the line a bit. He is the economist from the Employment Security Department, and who covers our county and Jefferson County. I had some specific questions for him and wanted to ask him some questions and share some information that I've received about our economy in general. So if anybody wants to stay on and listen to that conversation, you're certainly welcome to do so. But if not, I think we'll call it a morning. Jennifer, were there any last comments or words that you had?
I'm sorry, it just cut out. Colleen, can you repeat that question?
Oh, were there any last words that you wanted to provide?
Thank you.
Morning.
I did realize that I was remiss in not thanking our board president, John Nutter, for the work on the letter that Commissioner Randy Johnson and others have worked hard on. It's a very good letter discussing the regional concerns, particularly Clallam County's concerns about regionalization of healthcare. So I did want to really thank John for his leadership, as well as Randy. Those are really important words that I think in terms of a well-written letter, and so want to thank them. But I don't have any other comments except to thank everyone for the continued work as a community.
I did notice that Scott had a question for people that might want to volunteer right now, especially for supporting vaccination processes. Who should someone contact if they are interested in volunteering?
It is the County Emergency Operations Center, the EOC. They're coordinating all the volunteers. And that's another big thank you, is when you see that group working, they are so hardworking and efficient and incredible. So definitely encourage contact with the county EOC.
So that's at clallam.net, and I think right at the front of the website, they have information there on the EOC. All right, with that, thank you. I am going to stop recording.